Thanks for watching YouTube Medical University. Today we'll discuss the most common cause of high blood pressure. We're going to talk about a medication called Amlodipine. Actually, it has more side effects than you might expect, and there are ways to deal with those side effects. Sometimes, another medication is prescribed to deal with side effects, and some patients end up in a bad cycle where they keep getting more medications. Recently, I've heard many people say their legs are swelling. I didn't realize these symptoms were side effects of the medication. I can't even get up to use the bathroom at night now. That could be why. Those symptoms might also be side effects of the medication. This amlodipine is one of the most commonly prescribed blood pressure medications, so you need to be careful when using it, but it's not a bad medicine at all if you use it properly. If you ignore side effects, you may experience leg swelling, ill-fitting shoes, sleepless nights, daytime fatigue, and even impacts on your sex life. However, discussing these issues with your primary doctor can be challenging at times. This time, from the perspective of a doctor who usually treats high blood pressure, I'll talk about medications that are often used in the treatment of hypertension. I'll explain the effects and precautions of amlodipine, as well as the side effects you should watch out for. And finally, I'll talk about other situations where it's commonly used. I'll also introduce the characteristics of other commonly used medications such as sartan drugs and enalapril, so please listen until the end. It is said that nowadays 1 in 3 people suffers from high blood pressure. You or your family members may be prescribed these medications in the future. By watching this video until the end, you'll be able to recognize and respond to any side effects that may appear early when these drugs are prescribed. At YouTube Medical University, we share practical medical knowledge from a doctor's perspective in an easy to understand format. Subscribe to our channel for the latest videos. Let's begin today's topic. In short, what kind of medicine is amlodipine? Next, I'll explain the 4 main side effects of amlodipine that you should know, and then I'll introduce the characteristics of other medicines besides amlodipine. Well then, let's get started. Amlodipine is a calcium channel blocker medication. Instead of searching online, here's a brief explanation of what it does and its effects. Calcium channel blockers work by blocking calcium from entering cells of the heart and blood vessel walls, resulting in lower blood pressure. It's a medicine. The name is a bit difficult. The name might sound complicated, but it's actually simple. To put the main feature of this medicine in one sentence, it widens blood vessels. By widening the blood vessels, the pressure inside them goes down, which means your blood pressure lowers. That's what this medicine does. In our bodies, blood flows from the heart, passes through the arteries, and then returns to the heart through the veins. As blood exits the heart, amlodipine, a calcium channel blocker, causes the arteries to dilate. This widens the blood vessels, reducing blood pressure. It's a straightforward process. This medicine is also available as a generic, so it's relatively affordable. For example, amlodipine 2.5 mg. It's about 10 yen per tablet. If your medical expenses are covered by the 30% copayment system, at roughly 3 yen per tablet, taking 1 daily for a month amounts to only about 90 yen. It's more affordable than having a monthly cup of coffee. Amlodipine. This medicine has a very long duration of effect, so just taking 1 tablet once a day will keep it working for a long time. On the other hand, it takes some time for the concentration in your blood to stabilize, so even if you start taking the medicine, your blood pressure may not stabilize right away within a week. Please be aware of this. On the other hand, this amlodipine, forgetting to take medicine and check your blood pressure may still result in unexpectedly low readings. This kind of thing can happen, but that's because you took the medicine the day before or even 2 days before. That's because amlodipine remains in your blood, so if you check your blood pressure without the effect of amlodipine, you need to stop taking it for about a week, otherwise you won't know your true blood pressure. Even with 2.5 mg of amlodipine, it might not work. If your blood pressure doesn't go down, sometimes the dose is increased to 5 mg or 10 mg, but the current principle of hypertension treatment is to use a small amount of several different types of medications. So even if you increase from 5 mg to 5 mg if it doesn't change much, it's common to add another blood pressure medication to the 5 mg instead. Blood pressure can sometimes be high or low depending on the time of measurement. It's best not to measure blood pressure right after waking up. Instead, use the bathroom, wash your face, sit down, relax for about 5 minutes, then measure. Avoid checking blood pressure immediately after or before eating breakfast. To measure blood pressure correctly, watch the linked video. In another video, I discuss the dangers of high diastolic blood pressure and compare the importance of systolic and diastolic readings. Check the summary section for more information. So let's not stop at just those 2 videos. There are also 4 well-known side effects of amlodipine, so please keep that in mind as well. Amlodipine is a beneficial medication, but it has some lesser known side effects. Here are 4 of them. The 4 unexpected side effects of amlodipine. The first sign is swelling in the lower legs, which means your feet or legs become puffy. If you've recently noticed this, it might be the cause. Your medication may be causing this. If your feet are swelling due to amlodipine, please consider the following explanation. Blood flows from the heart through the arteries, circulating throughout the body and reaching the tips of your fingers and toes. The blood vessels become capillaries, turning into thinner vessels, and finally the blood returns through the veins, making its way back to the heart. Where does amlodipine work? It works here on the arteries. The arteries expand. When that happens, only the arteries expand like this. As a result, the blood vessels widen and blood flow increases. However, beyond this point, the capillaries are very thin blood vessels, so fluid tends to leak out here. When blood flows rapidly, the capillaries swell up like balloons, and this fluid leaks out and appears in the legs as swelling. If you think about it in terms of traffic, up to here it's like a 2-lane or 3-lane road, but the veins are like a 1-lane road. That's why congestion happens here. This congestion is what causes swelling in the lower legs and ankles. That's why it shows up in the legs. This is related to gravity. Blood flows out from the heart and travels all the way down to the feet, and then it has to return to the heart against gravity. Blood flow in the feet requires the most energy to return to the heart due to their distance from it. This is why swelling often appears in the feet first. I think it's easier to understand if you look at it in a diagram. Also, in rheumatology there are cases of vascular edema where the lips suddenly swell due to allergies or other causes. Some people may notice that their calves or eyelids are swollen and experience these kinds of unique swelling symptoms. In most cases, people don't realize that their swollen feet are actually a side effect of amlodipine, and they often just think, maybe it's because I'm getting older, and leave it at that. Many people don't consult their primary doctor about swollen feet. When they mention it at the hospital, the doctor might prescribe diuretics or other medications to reduce swelling, potentially leading to side effects like mineral imbalances. This may result in more medications being prescribed to address the side effects, creating a prescribing cascade. To avoid this, if you experience foot swelling after starting a new medication, consult your doctor. Lower leg swelling or edema is more common with higher doses of amlodipine. So many people experience it. Please be careful about this, and to check for swelling in your feet, there's a simple method where you press your thumb firmly against your shin. Try pressing your thumb against your shin for about 10 seconds. When you release your thumb, if the area you pressed stays indented like a dent, that's a sign of swelling in your feet. Sometimes just touching your feet doesn't make the swelling obvious, so if you haven't seen the video, please try it yourself. The unexpected side effects of amlodipine, number 4. The second one is nighttime urination. Nighttime urination means you have to go to the bathroom frequently at night. Do you wake up at night to use the bathroom? Many people taking amlodipine, a blood pressure lowering medication, struggle with having to go to the bathroom multiple times throughout the night. I would like to explain why amlodipine can make you need to go to the bathroom more often. In our bodies, there are 2 bean-shaped organs about the size of a fist, located in the lower back. These organs are called kidneys. Please take a look at this image to see how the kidneys produce urine. Inside the kidneys, there are many small round structures called glomeruli scattered throughout. Blood flows through these glomeruli, and from there, substances that become urine are filtered out and eventually leave the body as urine. Just like the capillaries in the alveoli, the kidneys also have muscles. When you eat licorice, these muscles contract, which causes more blood to flow into the kidneys than usual. Because of this, you end up producing more urine. That's why you feel like you need to go to the bathroom more often. If you think about the reason, it makes sense. So it's not just at night that you feel the urge to urinate more frequently, right? Based on today's explanation, you can see that you might also need to go more often during the day. This is the same reason as swelling in your legs that I mentioned earlier. We mentioned earlier that swelling in the legs is related to gravity. When you lie down at night, the height of your legs, your heart, and your head all become about the same. When that happens, the fluid that had pooled in your legs returns to the bloodstream. As a result, the amount of fluid in your blood vessels increases at night. This means that the blood flow, which had been sluggish, starts to move more easily. So as blood flow increases, your kidneys produce more urine, making you need to go to the bathroom more often. That's why you feel the urge to urinate more when you're lying down, and some patients say they wake up once during the night to use the bathroom, which can be bothersome. Some people wonder if this is due to an overactive bladder or just aging, but in many cases it's because they started taking medication and now need to go to the bathroom more often. In such cases, this may be a side effect, so consult your doctor. One unexpected side effect of amlodipine is leg swelling. Gum thickening means that the gums become swollen, and sometimes the gums can become inflamed or develop gingivitis. What is the relationship between blood pressure and gums? After starting blood pressure medication, some people notice that their gums feel worse, become swollen and painful, or even bleed more when brushing. Not many people realize that this could be caused by their blood pressure medication. But that's actually the case. If you think about the reason, it makes sense. As I've mentioned before, amlodipine works by dilating blood vessels to lower blood pressure. It's a medication. Those with mild periodontal disease or gum inflammation should be extra cautious. These days, it's said that 1 in 5 people has periodontal disease. When you have periodontal disease, inflammation occurs in your gums, and blood tends to pool there more easily. In that situation, if you take amlodipine, because of this, the blood flow in your gums increases, the blood vessels expand, and the blood flow in your gums increases even more, which can cause your gums to swell. For this reason, even if you didn't really notice your periodontal disease before, taking amlodipine can increase blood flow, make the condition worse, cause your gums to hurt, or even make them bleed more easily when you brush your teeth. The fourth unexpected side effect of amlodipine is erectile dysfunction. Erectile dysfunction, which is when you have symptoms of not being able to get or keep an erection. This symptom many may find it challenging to discuss this with their doctor. This side effect can strain marriages or damage a man's self-esteem, which is a definite possibility. So why? Why does amlodipine cause erectile dysfunction? Actually, this is a common side effect of blood pressure medications in general, and it often happens to people with high blood pressure. High blood pressure itself increases the risk of arteriosclerosis, which means your blood vessels become stiff and narrow, and blood flow gets worse. That's why. Arteriosclerosis itself is said to be a risk factor for erectile dysfunction. When blood flow is blocked, it can lead to erectile dysfunction. So, when amlodipine is prescribed in combination with other medications, you might wonder if something like this could happen. Amlodipine works by widening blood vessels and lowering blood pressure. Maintaining proper blood pressure is crucial for treating erectile dysfunction. However, if blood pressure drops significantly, erectile dysfunction symptoms may worsen. Clinics often prescribe a group of blood pressure medications called ARBs to manage the condition. For example, medications like irbesartan are said to have a protective effect on erectile function. So, for people who have symptoms of erectile dysfunction instead of amlodipine, doctors may prescribe angiotensin II receptor blockers type medications. However, it's dangerous to stop taking your medication on your own, so if you have any symptoms, be sure to consult your doctor or talk to a healthcare professional. You could also consult with a male staff member or someone who specializes in these issues. That's the review up to this point. Amlodipine is a blood pressure medication that dilates arteries, particularly the moving ones. Side effects include leg swelling, increased nighttime urination, gum swelling and pain, and erectile dysfunction symptoms. That's what I've covered so far. YouTube Medical University shares practical medical knowledge from a doctor's perspective. While there's valuable information about hearing loss on social media, some should be approached with caution. We share easy to understand information with reasons and data. Please subscribe if you like it, as that would encourage us. So, finally, in addition to amlodipine, there are also drugs like enalapril and something called usartan that are often used. I will briefly introduce these medications. These drugs belong to groups called angiotensin-converting enzyme inhibitors and ARBs. Since these are often prescribed after amlodipine, I think there are many patients who take them. The main effect of these medications is also to widen the blood vessels. However, the way they widen the blood vessels is a bit different from amlodipine. These medications work by inhibiting substances like bradykinin that cause blood vessels to constrict, which helps keep the blood vessels open. They also help the body get rid of excess salt and water, which helps maintain proper blood pressure. In addition, generic versions of these medications are available, so angiotensin-converting enzyme inhibitors often include generics. Enalapril, a medication in the angiotensin II receptor blockers group, costs only a few hundred yen monthly. Sartan, losartan or irbesartan and so on. Medications like these cost only a few hundred yen monthly with a 30% copayment, making them affordable and comparable to amlodipine. If you experience side effects from amlodipine, you can switch to these kinds of medications. These drugs are also used for people with chronic kidney disease, as they can be effective for those with kidney problems. So instead of expecting that effect from amlodipine, you would use these kinds of medications. Some people are already prescribed these medications, not just to prevent future heart problems, but also for their expected effects. While they are very useful, they can also have various side effects. Enalapril, which is classified as an angiotensin-converting enzyme inhibitor, can cause a dry cough when you start taking it. This cough is a well-known side effect of this class of drugs. At work, if you cough, people might look at you suspiciously, so you might feel like you can't keep taking the medication. There are people like that, but both of these drugs are said to work protectively on the kidneys. But actually, in cases of dehydration, taking multiple medications that strain the kidneys, particularly during dehydration, can overburden them. Some medications carry such risks. Without adding various things, your doctor is prescribing the most appropriate medication for you, especially when it comes to blood pressure medications. If you have taken these medications in the past, or if you are currently taking them, please let us know which medications you are on and if you have experienced any side effects. Sharing your experience can be helpful for others as well. It is said that when you take 5 or more types of medications, the risk of side effects becomes more noticeable, and the more you add, the higher the risk becomes. As you age and develop more chronic conditions, taking 10 or 20 types of medication is quite rare. Some people feel full just from taking their medicine and find it difficult. In my opinion, there is no benefit to taking more medications than necessary. As you age, some medicines become unnecessary, and the disadvantages can outweigh the benefits. It's also crucial to actively minimize your medications. Medications are not solely decided and prescribed by doctors. Decisions about whether to take or stop medications should be made through discussions between the doctor and the patient. You don't have to worry about being scolded just because you ask about side effects or whether you can stop any of your current medications. I believe it's important to look at seniors who are able to manage with as few medications as possible and aim to take only the appropriate medications in the right amounts. I hope you'll keep that in mind. Was that helpful? This time, let's learn about amlodipine. I introduced the side effects and characteristics of this medication. Some may worry about the side effects or think there are ways to lower blood pressure without medication. For those considering how to lower their blood pressure, I've released a video about dietary therapy, so please check it out from the summary section below. It should be helpful. I would be happy if this video could be of any help to your health management. If you found this video helpful, please press the good button. It really encourages me. A single comment would motivate me to make my next video, so please leave one if you don't mind. See you next time. See you in the next video. As an integrative medicine doctor, I've learned from my patients how to live youthfully into your 70s and beyond. My book was the #1 bestseller in Amazon's 4 departments. I summarized important health methods I learned from patients while working as a doctor. This popular book will inspire you to live a healthy lifestyle. It's currently on sale, so do check it out if interested.